Sometimes the things that cause anxiety could be phobias. So the person feels anxious when they're exposed to these phobias. Some phobias are simple. It could just be something small like spiders. There's an extreme fear of something that's not necessary. The fear is disproportional to the amount of danger that the person is in. So an extreme fear of spiders, or for me, slugs, I can't even hardly think about them. So I would say I have maybe a simple phobia with slugs. Some people have social phobias, so being out in society, having to talk to other people, that can be very anxiety-ridden for them. And then agoraphobia, I call that a fear of fear. So you're afraid of going out and doing anything because you're afraid that you're going to become afraid when you do that. So it stops you from doing a lot of things. Post-traumatic stress disorder is after some type of stress. So we call it PTSD, and probably the number one thing that comes to people's minds is soldiers when they come back from war or from being out on the field. They may suffer from PTSD because of the things that they've seen while they were out and they didn't have a way of coping with it. It can lead to anxiety. It could also lead to depression, which we'll talk about too. But it doesn't just have to be from war. It could be any traumatic experience that the person experienced. It could be a car accident. It could be rape. It could be witnessing a murder or something just horribly traumatic to that person that then affects them for the rest of their life. Some mood disorders. Depression is kind of define it as a feeling of sadness, but it's a little bit more than just a feeling of sadness. It gets to the point where it's debilitating to the person, and it prevents them from doing a lot of the things that they enjoy doing, or even the things that they need to do, like go to work. They don't have any motivation. They feel very apathetic, where they don't feel like doing anything. Sometimes it's not even a feeling of sadness. Sometimes it's just a feeling of deadness, of not feeling anything. Almost like having an out-of-body experience, that you're watching your life happen to you, and not being able to connect emotionally to anything. So that could be a result of PTSD from trauma. Could be a result from a traumatic childhood experience or adverse childhood experience. It could be a result of a chemical imbalance. So sometimes medication can be helpful for that. And then bipolar disorder is a combination of depression, so periods of depression, but also these periods of mania, so manic. And during those periods of mania, the person will feel very, very good. They have a lot of energy, a lot of endorphins are being released, they feel really happy, but it can lead to some behaviors that can be destructive, like overspending or risky sexual behaviors. Being very, very out there, not sleeping, heart rate might be high. So it's not healthy. It's kind of like a seesaw back and forth of depression and mania. And a lot of that could be due to a chemical imbalance, or environmental factors too. Sometimes medication can help with it. So schizophrenia is difficult. So this is an actual disorder of the mind that we can see on an MRI. Different parts of the brain light up than normally do for a mentally healthy person. And it causes the person to have delusions, which, if you remember from dementia, a delusion is a false belief. So that's very common with schizophrenia. My grandmother was schizophrenic, and she believed that she was a very famous person that everybody wanted to meet and be with, but she wasn't. So, but you couldn't convince her otherwise. And it can also lead to paranoia, that somebody's trying to hurt you or harm you or steal from you, poison you, kill you. And it can lead to these auditory, visual, tactile hallucinations, which are real to that person, and you won't convince that person otherwise. And it's not helpful to convince them that this stuff's not real, because then they just won't trust you, and they'll just label you as someone not to be trusted. So the best thing to do with somebody who's schizophrenic is to reassure them, let them know that they're safe, that you're not there to harm them, and acknowledge the reality that they're seeing and hearing. Okay? So it's almost like validation therapy when we talk about dementia, that we want to validate their reality, make them feel safe, and keep them safe. A lot of people tend to be afraid of people with schizophrenia, but not very often are they harmful towards other people. It's only if they feel threatened, like if anybody were to feel threatened, your fight or flight kicks in. Sometimes people fight. This person may be harmful to themselves. Okay, so no reason to fear them. So substance abuse or addiction is extremely common. So probably number two top ones that come to mind are alcohol addiction and opioid addiction. For us in this country, we have an opioid crisis right now where Delaware was in a state of emergency for a while. I'm not sure if they still are, because of this opioid epidemic, where we have so many people that are addicted and overdosing. It's just kind of taken over our society. So it's becoming a more and more prevalent problem. It's not getting better. And unfortunately, a lot of times substance abuse coincides with another mental illness, like bipolar disorder or depression, where the person is trying to treat those feelings with some type of substance. So they're trying to mask it. It's compensation. It's that defense mechanism kicking in. Compensate for that loneliness, that sadness, that grief with a substance. But of course, we know, it requires more and more of that substance to get that same feeling. And so it compounds itself and it gets worse and worse. So the incidences are rising, and this is going to be something that you guys will be seeing a lot of, and it's very hard to treat because oftentimes you're trying to treat two disorders instead of just one. And you have to get past the substance abuse to get to the original mental illness, and it's difficult. So three eating disorders that we're going to talk about. Anorexia nervosa is more common in females, although men can experience it. It's also more common in white females, but it can be experienced by any race. So most commonly we see it in white males and females, and it's this overwhelming obsession with body image and being thin and having control. And really, when it boils down to it, it's more just having that sense of control, that you have your body under control. But it has the highest mortality rate of any mental illness, because the person essentially starves themselves to death, and their heart will just eventually stop because they don't have any calories to survive anymore. They don't have any energy. So that's anorexia nervosa. Bulimia is binge eating and then purging. So they might eat a large meal and then either induce vomiting or take laxatives to try to get rid of everything that they just ate. And they might also be very obsessed with exercise. With anorexia too, anorexia and bulimia, there might be just this hyper obsession with getting rid of these calories. So anorexia, the person is typically very, very thin, where with bulimia, they may be in normal body weight or even overweight. So it's a little bit harder to recognize, especially because that person's probably not going to be forthright in telling you, yeah, I purge after I eat. That's something that they typically don't share. But it can lead to problems like ulcers in the throat and the mouth, tooth decay, and obviously they won't have enough energy to live. So binge eating is just eating a lot of calories, but then not purging afterwards. So this person is going to probably be very obese and overweight. And it is a way to compensate, right? So that's a defense mechanism. They're compensating for some feeling with food. So first, it's almost like an addiction. So we have to remove that addiction and then treat the original mental illness. So that sometimes makes it difficult. You're dealing with two things. So the problems with these mental illnesses is that they can lead to death. If you think about anorexia, the person could starve themselves to death. But we also worry about overdose with addiction. We worry about liver failure with like alcohol, and then we worry about suicide with all of them. Sometimes a person loses hope that things will ever get better, and if you lose hope, you don't really feel like you have anything left to live for, and then we worry about suicide. So for you guys, if you ever have anybody that says they want to kill themselves, or they're thinking about killing themselves, you need to take that seriously. If it's a patient or a resident, you need to get help right away. Don't leave that person until they can be assessed by someone. If it's a loved one, you need to call the police. Don't worry about if it's a false threat, or you don't want to get the police involved. Go ahead and involve the police. Call 911. I've done it on family members. It's just not something that you can mess around with. It's not something you want to take the risk of being wrong with. We don't have the right to kill our own selves in this country, so that's still something that you could be involuntarily committed for. You might end up saving somebody's life by doing that. So take every threat seriously. And then other concerns with mental illness, if it's not being treated, we worry about violence towards others, whether it's towards children or other vulnerable adults, spouses. Some people take that anger out, that displaced anger, frustration, guilt, and they put it on somebody else. So we want to make sure that we're treating these things just like we're treating heart disease or lung disease. So there is hope for all of these. With therapy, people could see a psychiatrist or psychologist, and they can talk through it. They can be put on medications that may help if there's a chemical imbalance, or if there's anxiety, relieve some of that anxiety. And then less common is electroshock therapy, but that has been shown to be helpful. It kind of resets the brain, stops it, resets it, and then it seems to help for a while. It's not necessarily a permanent solution, but we do still practice that sometimes. So the point is that we want to make sure that we're not allowing that stigma into the way we care for people. We're not being judgmental. We're just treating it as we would any other disease. It's just a disease of the mind. Okay, so we'll make sure you watch all the videos that go along with this so you have a better understanding of what you'll be dealing with.